other people will come. So welcome everybody, and particularly welcome Nadine Coy, who's our guest today. And just to explain, I'll introduce Nadine in just a few seconds. But I know many of you have come to these sessions since we started them, we started these we actually started having this session in April of 2020 as a kind of community event, and then in the fall of 2020, we decided we would keep it going, but we invite guests to it who could tell us something about what was going on in business as a way of supplementing our knowledge about business. It's both good for students because you can test things out about what you're learning in the classroom, and it's good for our faculty to listen to people who are really working in business. And we have some business guests as well here who support us. So I appreciate everybody coming. And then just remind you of the format. After I introduce our guests, I'm gonna spend about 20 minutes having a discussion about that, and then I'm going to break you into small groups. The groups are going to be completely random. Nadine, I'm going to put you in a group. I don't guarantee who you're going to end up with. If I see it's somebody who's really, you shouldn't be with, I'll move you. But it's and during the small groups, it's community building. In the small groups, I really expect you to come back from your discussion and post some questions in the chat, and then with the help of my colleagues, so Danielle and Kathia, I kind of collate them, and we continue our discussion, and we can cover whatever topics you feel that you're most interested in. So if you have questions in the first 20 minutes, just put them in the chat. I'll get to them. I'll get to these when we get to the question answer bit as well. So Nadine, I'm really pleased that you could come. Nadine is the COO of Healthcare Executive. She's with the Health Services for Children with Special Needs. That's is their organization, which is it's a organization serving the greater DC, Maryland, Northern Virginia area. I'm correct there, and we're going to talk a little bit about what that does. But Nadine has got a really extensive career in healthcare, and I really wanted to invite her because I think it's a kind of rare opportunity to talk to somebody who it's not a clinician, it's not at all, but it's got business degrees but has been deeply involved in healthcare for a long time, right? I know that you started off with Evercare, which I think became part of United Health Group, and I think 1999, when they but it's been a number of healthcare businesses since then. Allen Healthcare Service, and it's been with Health Services for Children with Special Needs since 2017. She's now the Chief Operating Officer, and keeps the organization going. And we're going to talk about how you keep the organization going from a strategic point of view and from a day-to-day point of view as well. Nadine comes from Jamaica, and it's giving us so special sensibility about healthcare issues there, but she's also particularly interested in healthcare issues that affect people from who are socio-economically challenged, right? And that would be the way to, I think. So we'll have a chance to discuss that and also what she's learned from Jamaica during our discussion. So Nadine, welcome, and so thank you. And maybe just to make sure everybody's on the same page and got a picture of what your current organization does. So I know you've got a broad view about healthcare. It'd be great if you could just give us a little bit of a picture about what Health Services for Children with Special Needs who it is you serve, what you do, and kind of what your job involves there, having explained the organization. Okay.
Right. Thank you. Thanks, Murray. I am delighted to be here, delighted to be part of this talk. I hope everyone can hear me okay. It's such an honor, and I am humbled to have been asked to participate in this forum. And it was such a delight in talking with Murray. And quickly, I learned that there was quite a lot of synergy with University of Maryland, Baltimore, to my past and to my history. As Murray said, I am currently at Health Services for Children with Special Needs, and it's a health plan, a licensed health plan in the District of Columbia. We are now a division of Children's National Medical Center. We were acquired 3 years ago. We're going into our 4th year of integration with Children's National. And our population, it's a Medicaid program, Medicaid product. HSCSN have been the sole awardee of the CASIP contract, and that is the Child and Adolescent Supplemental Security Income Program under Medicaid for children from birth, from 0 to up to age 26. So if they're SSI and they have some chronic illnesses and they're Medicaid, they're then eligible for our program, for the CASIP program. And we've been the sole awardee of the CASIP program contract with the Department of Healthcare Finance for over 20 plus years from its inception. It started as a demonstration program, and we participated in that and continued to demonstrate to the district that for this population, for our pediatric population, our most vulnerable, they require a special focus healthcare delivery than the standard average pediatric population. So it made sense, even with our integration with Children's National. It's the perfect synergy for the two organizations to have come together to really create a much more holistic and integrated healthcare system. So that's me. I hope that kind of helps you with kicking us off, Murray.
That's great. And, and it would be, let's talk a little bit about, first of all, the population that you're serving first, and then talk a little bit about, how this fits with your job. I mean, what, with this population, what are some of the special challenges, and that you face in dealing with this type of population from a healthcare delivery, standpoint?
Right. And, as I talked about, so this is a special needs population. And what I mean by that is that they have chronic illnesses. In addition to that, these are our more underserved population. So they are the Medicaid population, Medicaid beneficiaries in the district. And our standard or typical child have multiple medical conditions. But more than 50% of our population have some kind of mental health, behavioral health challenge. So these are children that are born with numerous medical complexities, and that is that's the core of why the CASIP program was developed. It's really to understand and recognize that healthcare, which I am such a strong proponent of, healthcare has to be customized. It's not a standard cookie cutter approach. It's not the standard approach to healthcare delivery, but we've got to look at healthcare from an individualistic perspective to really understand what are the needs. With our population, not only are we dealing with medical complexities, but there are also social complexities and challenges that we're dealing with in the district. There are areas, more than 70% of our population resides in the districts, Ward 7 and 8, where there are food deserts, where there are housing insecurity. And so it's really looking at not just the medical needs of the enrollee, but it's really looking at all of the social issues that can affect their health, that does affect their health, and being able to help to navigate. Now, we're a health plan. We are not in the business of developing housing, but we can help to connect them with housing resources in the district. So that speaks to the heart of why I love what I do, and I love the program that I'm administering, because I see the real life impact on individuals, and how we're able to change their life and impact it in a positive way.
Right. Now that, you know, I want to take you back a little bit and find out, you know, how did you get into healthcare in the first place? And you know, maybe two things. You know, how did you get into healthcare in the first place, and just, you know, what kept you there, and you know, and got you to where you are today. You know, so.
Well, it's my healthcare journey has been pretty interesting. Sometimes when I sit on and reflect on it, you know, I have a son, one child, he's 19, and right now he's at GW and pretty focused and knows kind of where he wants to go and what he wants to be. Well, that wasn't his mom. I did not know what I wanted to be when I grew up. So healthcare, my entrance into healthcare was out of necessity of needing a job. I got married when I was young, and my husband and I, we needed to create a life and, you know, make income. And so I ended up my first job at Blue Cross Blue Shield as a claims examiner, claims processor. And that was my entrance into healthcare. And still at that point in time, it didn't quite connect to me that this is part of your purpose. And so as I continued along the healthcare path, I ended up at United. And I'll say to you, that's where the awakening occurred. I recognize, and I worked for a division, as Murray mentioned earlier, a division of United called Evercare. Again, another special needs population, but for the geriatric population that were residing in nursing homes, and again, providing a customized approach to their healthcare delivery. And that's when I really developed a passion for special needs population, and I developed my passion for improving healthcare delivery. I am not a clinician, even though my family sometimes want to believe that I am, but I am not a clinician by any stretch. But my focus is improving healthcare delivery and making sure that the delivery system, the operational system that undergirds our clinical delivery is running efficiently. And that's where I learned that. I learned a lot of the disciplines, operational disciplines around healthcare. And that's where my love and my passion was first started to really become real and clear to me. So didn't know, and started, you know, just as I said, just by the need of having a job. And while I was there at United, I decided to pursue my degree. So very similar to a lot of the students at UMBC, I acquired most of my degrees. Sorry.
University of Baltimore.
I'm sorry, University of Baltimore. I'm so sorry. But I acquired both of my degrees while working, from, you know, going to work full time and going to classes in the evening, in the afternoon after work, and studying late nights and so forth. So as I said, didn't have a clear vision of what I wanted to be, but just by following the path and staying along the path and being open and being really attentive to why I'm doing what I do, and it really framed my purpose and revealed the purpose for me being in healthcare.
And you know, so how important was you know, you got a degree and you got your MBA as well. I mean, you know, what did you bring from your degrees to the, you know, back to the organization? You know, it's
the thing that I loved about the program, and I attended University of Phoenix here in Columbia. I live in Columbia, Maryland, and when they opened their satellite office, I was one of the folks that that enrolled at University of Phoenix. And what I love about the style in the program was, one for one, it's catered to working adults. So you're able to really take what you're learning and you're able to take it back real time to your workplace and apply it. So a lot of the disciplines that I learned around, strategic planning and, critical thinking and the discipline of developing those skills, you're able to take them back real time into your workplace. And you continue to develop on that. And, for me, you're always learning. I am constantly attending seminars because having a degree doesn't make you to have acquired all the knowledge you need. So posturing yourself, positioning yourself to continue to learn is important. And that's how, and being able to take it back. And part of the learning is applying it. Yeah. To me, you're only gaining information if you're not applying it. So I am always seeking out opportunities for how I can apply the knowledge that I'm learning.
And I'm sort of interested, by the way, I should put a footnote for the audience. I signaled out Nadine as somebody from our marketing department, marketing people to have a discussion with about how she missed the University of Baltimore. But it's Danielle wasn't working for us when that's the only excuse. She wasn't working for us when you went to degree. But I'm thinking in this continuous learning, and we've had a discussion in some other with some other speakers about what have been the leadership challenges in the last few years. And I'm just wondering for you, what are the what have been the really big leadership challenges then that you've had to sort of bring and sort of then focus on?
Well, I'll tell you, the biggest challenge we're facing right now in our organization and in healthcare overall is staffing. Since the pandemic, healthcare really got, I would say, probably one of the biggest hits, as from the pandemic. And as a result of that, there's a shortage of nurses, clinical staff. And so we're struggling. And, our program, the 80% of our staff are care managers. And so those are your RNs, your LICSWs, social workers. And so with healthcare getting the hit, and, as a result of the pandemic, I believe that a lot of folks took that time to reevaluate their purpose and what's important. And as a result of that, I think there's a lot of reinventing themselves that's occurring, and healthcare is feeling some of the impacts of that. And so we're struggling, with being able to staff up to support our membership. And we have some specific requirements around care management to enrollee ratio that we've got to continue to meet. And that's one of our biggest challenge that we're facing right now. It's really staffing and, as a result from the pandemic.
Yeah, that's and has that made you sort of had to think about other, both processes and how the organization kind of works,
Yeah. And it made us had to, part of that, what we started to really consider is the care management structure that we have in place of, one care manager to enrollee, is that the right structure? So right now we've redesigned that. We took the time to reframe that. And now we have a team that we've developed that, again, aligned with the primary care physician's practice, but having a team that is supporting our the enrollee so that we're able to address some of the social issues as well as the clinical issues. And we recognize that structure is a much more effective structure to be able to also address some of the challenges that we're facing with staff. And we've got to rethink even our benefits. What is it? How do we make ourselves more marketable and competitive than other organizations? Because we're competing as a health plan where we're hiring clinicians, we're competing with the hospitals as well. We're competing with the physician practices. So how do we compete with that? And how do we remain competitive? And so we've had to look at, from our recruiting strategy to our benefits package and offering, as well as being able, our enrollees, our care managers are primarily out in the field, interacting with our population. How do we make that much more attractive? So we've had to also incorporate a telehealth component to how we deliver those face-to-face visits. So, again, using this crisis that we're coming out of to really rethink and reimagine how we can deliver and administer the program.
Right. And so, you've bundled the whole set of things there into one, which I can see, you're from a business point of view, it's kind of interesting because you're kind of pulling together, efficiencies of systems, which we, I know as a Professor Gu, who I introduced you earlier, we talk about, teaching about we teach students about how to develop operational, efficient systems, right? And so this is, at the same time, you're implementing new HR processes, new technology platforms at the same time. Is that that's John. So here be how did the merger sort of affect then what you have to do from a leadership point of view? Because sometimes we discussed this with some other speakers. sometimes mergers and acquisitions can be an opportunity, but sometimes it can be a distraction and get away from your mission. So how did the merger and acquisition, what did that do to you as a leader? How did that affect you?
As I'll tell you, having gone through many organizations, and one of the things that with United, being at United for the many years that I was there, I was able to participate and be a part of quite a bit of mergers and acquisitions. United acquired quite a bit of health plans throughout their history. Being at Health Services for Children's National, and really in a much more personal way and upfront way, I got to participate in that integration. So we had to really think about, what are the firewalls? We have two different and distinct healthcare disciplines that's coming together, but there still has to you still have to be able to remain some firewalls. So as a health plan, which we are a payer of services, and Children's National being a care delivery system, a provider, what are those firewalls that we need to put in place to make sure that we're not crossing the lines? Those are things that in this merger, this integration, I had to participate in very closely. What's the benefit package that our organization, HSCSN, have in place versus what it is that Children's National? So how is this going to impact my employees? What's the benefit to them? How do we look at the organizations and all the assets and services, and what can we say, okay, rather than each individual unit performing those tasks, such as HR, how do we share those resources? And so we develop contracts and agreements around shared services, functions, IT, HR. So this integration, being part of it, I was really able very closely to kind of really work and understand and advocate for the things that are important to us as a health plan, as well as to our employees and our enrollee population, while also making sure that we're not blurring the lines with the Department of Healthcare Finance, who we have the contract with. So there were lots of pieces, that we had to work through to be able to get to a good, integration and acquisition.
Good. I think you've given us a good setting, and so what I'm going to do now is, put into breakout groups. These are going to be pretty small groups, so you have a chance to introduce yourselves and have a discussion about there's lots of things to discuss, healthcare, where it's going, and I want you to come back and we'll kind of gear the rest of the discussion. I've got lots of questions still, but we'll sort of gear the discussion around, what what our groups chat, and as I say, Nadine, I'm going to put you into a group. This is purely random. If you haven't been here before, I always say this, there's no, we have students and faculty and business guests. There's no assessments in this. Everybody's equal on this one, and and it is truly random, because I find that works best. One thing for the audience, by the way, don't leave now, please, because what it does is it kind of affects my distribution of people if you leave. So I'm going to now create rooms. So we're going to have about six rooms, I think. So okay. Damon was asking about the pay structure for staffing. Is it about? I think you're asking, is it about just the sheer amount of money that people get? There's a lot of hard work in it. Is it comparative pay that, or are there other aspects to what's going on there with your
Right.
search for talent?
Yeah, that's such a good question, Damon. I think it's Damon who asked that, correct? Yeah. Good question. And one of the things, as I shared earlier about our staffing challenges, one of the things that we've also had to look at, that I'm working with our HR business partners on and our compensation team, is to develop and to implement a performance incentive-based compensation. So again, looking at how do we remain competitive? How do we compete in this market? We've got to be creative about what our compensation package look like. Folks coming in, they have now different needs from a family, work, lifestyle needs, from vacation allotment to how even vacations are allotted or accrued. So it's really looking at your total compensation package and benefits, and really thinking about, for this economy and for this where we are in our workforce, how do we make sure that we are able to offer the most attractive package to a potential employee? And so we are really aggressively, we recognize that a performance incentive-based compensation element to their salary, to their compensation is important for us to implement on. So we are hoping that in the next couple of months, I'll be able to say that I've implemented the first performance-based payment structure at our Children's National Organization.
Good, thank you.
Mm-hmm.
Here's a sort of follow-on question for that, and I'll get it clear. Has got two questions per group, because I think the more general question, comes from, again, it was Damon, and a group of Damon was in, but I'm sure compensation is just one part of it. What are the other things? What you think really should be done? How can the shortage, the talent shortage in healthcare, or how do you think that really should be addressed? I can see compensation is one part of it, but there must be other aspects to this as well.
There are other aspects, hybrid work structure. I now, since the pandemic, I no longer go into my office 5 days a week. I used to live in Columbia, and I used to commute into the district 5 days a week. On average, on a good morning was an 1.5 hour commute. Bad morning, 2+ hours. That's 4 hours, 3 to 4 hours out of my day that I was putting in. This pandemic has caused organizations to really step back from that and recognize, what is the value? Can work be done in a hybrid setting effectively? And if it can, why are we paying and taking on real estate? So I'm also now, my lease in my Vermont Avenue office is up for renewal next year. So I'm in the process of assessing what is our space footprint that we need to be able to support a hybrid work structure. Those are the kind of things that, you know, we're looking at to make ourselves, because we know that the market is saying, we want hybrid, we want remote work. When I look at what jobs that are being offered, more often you're seeing remote, hybrid. That's where the market is.
And let me ask you a follow-on question on that, because I know you, from our previous conversation, you know, one of the things you really enjoy doing and you pride yourself in is building teams.
Mm-hmm.
And so, you know, and we've had this discussion with some other speakers as well. What have you learned about building teams in this hybrid environment? Is it, you know, how different is it? You know, what are some of the things that you've had to do to build your teams?
Right. And I'll say to you, and you know, one of the key thing is about being nimble and being able to pivot when needs be. So I have a well-established team. So most of my team members have been with me pre the pandemic. So they know me. We've developed relationships and they know my style and personal style and all of that. But then when you hire someone new, when someone new's joining the team, you've got to think about they don't have that knowledge of you. So how do we be creative in bringing them on and building? And sometimes it's now saying, okay, rather than us being out, let's meet for coffee. Let's have a working session somewhere. Or let's be purposeful when I do want to be on site. Let's be purposeful about that. So one of the things that we've implemented, all of our new hires, for the first 2 days, they're required to be on site and to meet the different managers in the organization and leaders and to be oriented so that they have some real person interaction. I think those are the kind of things that we've got to be creative and be innovative about to be able to make a hybrid work environment work to its fullest, and that we're not losing out on the people interaction and relationship building, because I think that's important. It's critical.
And it's now there are, you know, there are two questions that came from Claire's. I'm going to ask you one question because it's quite specific and it's not about your own organization, but it's also dealing with other vulnerable populations as well, and it's a population we serve in the University of Baltimore. And so this group's asking, where can we find resources and healthcare products options for ex-offenders who are reintegrating into the community? You know, returning citizens. I don't know if you got some specific suggestions around that, or you know.
No, because of the work that we do and our population being pediatrics, you know, of course, these are children you know, so I don't interact and have that much knowledge and experience, being, you know, completely open and honest about that around, you know, what are the healthcare things in it, you know, for ex-offenders, and how do we, as they're entering community, what are the resources that are there? I would imagine, though, you know, there are times that some of our children get into trouble and they end up in being incarcerated. And unfortunately, at that time, once they're incarcerated, they're disenrolled from our program. And so, you know, and that's something that you're now kind of stimulating my thinking around, you know, are there things, how do we ensure that the continuity of their care continues while they're incarcerated and after, you know, they're then back in the public setting. You know, we have children in foster care, and those care continues while they're in foster care, and being able to provide services for them while they're in foster care, or, you know, child protect CFSA. But I am really not as well versed on what are the resources that are out there for folks that are, you know, coming back into the community from a healthcare perspective.
That's good. There, there's one which I'm going to get. I've got kind of order in my head, so I'm going to try and get to as many of the questions as I can. But I saw one pop up, which I think we should go back and address, because it's a kind of it's a long comment, and I'm going to try, if you don't mind, Kira, I'm going to try and reduce it to get to the kind of key question. But it's actually starting with a proposition, really, Nadine, about why there's a healthcare shortage, and the proposition is that, there, and this is not about your organization, I think it's about healthcare in general, there's a kind of a lack of empathy, faithfulness, intimacy, trust with employees. So there's sort of been a breakdown there of that trust, and that what's required to change that dynamic is a different sort of organizational management style, which is much more about empathy and understanding what's required in their jobs and how to deal with it. So that's, I mean, I don't know how you would, employers need to start putting their employees and patients above there's a kind of a statement that, above profits, in this case. So, I'm
Totally agree with you there, Murray. It's about empathy. And, for me as a leader, my passion with leadership is to make sure that I'm being true and authentic as a leader. And I think that's what people want. When we're working, whether it's in healthcare, whatever organization, we want folks to be authentic and to be true about what's the situation. We just recently completed our employee engagement survey. And one of the areas that I thought our score was lower than I would have wanted to see was around trust and honesty in our leadership. And that's, even though we scored high, it was still a drop from where we were over the last 2 years. And so I identified that as one of the areas that I think we need to focus on, because we've got to be, our folks, our staff, our community, and the way we operate as an organization has to be one with integrity and authenticity. We've got to, I believe in, you've got to say what you mean and mean what you say. You've got to stand by your word as a leader. And that sometimes is really hard when you're facing challenges, financial challenges, budgetary challenges. It's hard, but we've got to recognize, that I recognize that my staff, we will never be able to deliver on the program in its fullest effectively for the population that have been entrusted in our care. And I say entrusted, we've got to see this as you're a steward of being able to deliver, whether it's care or it's service that you have to provide, whatever it is, you've been entrusted with that capability. And you've got to be true to that. And so when I sit in my budget meetings and we're working through budgets, it's okay, what's important? I've got to make sure that I'm delivering the right care delivery for my population. And I've got to make sure that my staff that has to deliver it, they have what they need. They have the tools they need. As I mentioned, a large percentage of my staff, of my enrollees, resides in wards 7 and 8 in the district. Lots, we hear it on the news. We see what's happening in those wards. A lot of gun violence. I have an employee recently that was in the midst of some, gun violence in the district and literally had to hide. I've got to make sure that that staff person is getting the support, the mental support that he needs in order to be able to get up the next day and to still deliver on the care for the enrollees. That to me is how an organization operates from a place of integrity and authenticity. And that's how we build trust.
Right. So having that, it sounds like, there's both, as an employer, it's both having the empathy, both about the employee, but also having an empathy about, your population and you're serving, your patient population and what situation they're going through. Is that Is that right, Nadine?
Yes.
By both. And I'm gonna, what are some, how do you sort of develop that within with employees, in terms of, selection, is it a selection issue, and then a labor shortage? How do you, how do you move, professionals to have that kind of appreciation for people and what they're, what they are going through, and Ward 7 and 8, and Ward 7 and 8 are replicated in school and in four corners of Baltimore, so we understand them. Okay.
I will say to you, for me as a leader, and that hire folks, one of the things, how I go into interviewing and when I'm looking for individuals, I look for one, competency, but coupled with that, I look for, is this the right person to fit with the mission and the purpose of this organization? And sometimes as hiring managers, in the haste of getting a body into that position, we miss that part. And as a result of that, we end up hiring individuals that don't align with the mission of the organization. They don't have the empathy for the population that we're serving. And therefore, it's a constant friction in those values. So I really try to make sure that I'm teasing out what about this population speaks to you, and tell me why, so that we make sure that we're aligned from the recruited. And then we continue to do that. Part of my orientation, I want every new hire coming on, you need to shadow a field-based person going out into the community. So you see very clearly who we are here to serve. That's how you develop that and maintain that. And, we're constantly during our all stuff, we're talking about, sharing, we talk about mission moments where we're hearing from our clinical folks, a real life case of a, enrollee and how we've impacted their lives. And, what's the story about it? So that our staff are constantly, whether you're on the front lines or you're back in the office, making sure that our meetings are scheduled on time. You never forget why we do what we do. So it remains relevant. That's how I make sure, and how I, encourage our leaders to constantly keep the mission of why we're doing. And it's not just words on a paper, but show them the real people that we're impacting and that we're serving.
So it's having a real sort of change in that population, and I think this relates to there's two questions I'm going to kind of put together, and then I'm going to have I have a closing question, but and I think you may have partly just answered it just there a little bit about it, but I'm just, there's a question that's more general about about what advice would you give to students who are uncertain about their career path, particularly those who have experienced disillusionment with employers due to the pandemic, and how can they discover their true passions and interests? So you're obviously tapping into some people who are finding their true passion and interest for this population, but what advice would you give to the students? And there's one I think you could sort of follow on, which came from another group, about what advice do you have for students seeking a career in healthcare? So I give you a chance to look, the general career advice, and then advice for on healthcare.
As I mentioned, general career advice. Sometimes you will know right out the gate what you want to do. As I mentioned earlier, my son knows exactly what he wants to do right out the gate. I didn't. But what I did know is that I wanted to make sure that I was living out my purpose. I was fulfilling my mission, what's important to me. And I didn't know that it was healthcare. But I think, quite frankly, you've got to look at your wiring. I'm always, and from a child, was always the one, my parents would say, is almost like the nurturer. But also, I always wanted to make sure things are done in order. Isn't that an operations person? That's who I am. By nature, if I'm planning a family gathering, a dinner party, from participating in something at our church, I want to make sure, have we walked through the steps? Have we done what we need to for each of the steps? That's the way I'm wired. Being in tune with your wiring. Don't try to use somebody else's concept of what your wiring is. Be true to who you are. Be your authentic self. And when you realize that your knack is in accounting, go after it. Don't stop until you fulfill that purpose. Go after it. Once you learn, be true to who you are. Don't go with any illusions. Don't go with what somebody else may want to impose on you. Recognize what your wiring is and go after it once you learn it. And I'll tell you, if it's healthcare, jump in. It is a fulfilling industry. I love it. I love healthcare because, again, I see the impact we have. And even as Murray mentioned, I'm originally from Jamaica. And, during my career, I've engaged with various healthcare leaders in my country to say, let's talk about operationally. How can we improve the operations of healthcare in Jamaica? What are the things that we would need to do? And kind of engage in conversations around that, because it's important. And I see the value when you have an operational system that's ineffective. It affects the outcomes of that product. And I see that sometimes when in our processes, when they're not effective, when they're inefficient, I see the results. I say, why are we not hitting this metric? It's because my processes are wrong. But when we develop good processes, the outcomes are better.
Right. So here's my final question, and we're just about over this, so we've only got a couple of minutes. But if you had to do a quick summary of what would be the key knowledge or skills or attributes that you believe that students need to bring to the workplace today, and you've talked about bringing themselves, what they're passionate about. What would be the kind of key knowledge or skills or attributes you think they need to bring to the workplace?
I think coming into the workplace, I think what I would say is bring the concepts and the knowledge that you're learning, bring them to the workplace. Don't just leave them in the classroom. Don't just leave them in the textbook. Seek out ways to apply those concepts because they're relevant. They're important. That's the knowledge that you have invested in. Don't be afraid to bring it back to your workplace and to apply them. When asked questions, how can I learned this, I see this concept. How does that work here? What can we do here? Challenge the thinking. Don't be timid about it. Take the knowledge back and apply it. Don't just let it be theory, but we've got to apply it. That to me is one of the biggest value of what I would say for students that are graduating, students that are going, that are learning. Look for opportunities to apply them. Organizations, we need that. Sometimes we need fresh ideas, fresh concepts, new ideas coming in through new lens that, hey, I just learned this. Could we think about this differently? So that would be probably my primary recommendation.
Well, thank you. Listen, I really thank you, Nadine. I really admire your passion and when some of the students may remember this, I give a little talk at orientation where I usually talk about how the Dean of Nursing at University of Maryland, Baltimore, across the street from us, would be talking about nursing as a vocation and introducing students. And I say, I think business is a vocation, and I think because I think we can apply to serve people and to serve our customers in all sorts of different industries, and that's what the knowledge that we bring, and you exemplify this as well. So I really appreciate it. So we'll give a big sort of electronic clap. It's and it was great. And so I want to thank everybody for coming. Just next week's spring break. So if you're a student, you don't have to come on campus. And if you're an employee, you actually get March 24th off. Completely. So and. And our next session is actually not going to be until April 11th, and it's with Rob Sharp, who's the CEO of T. Rowe Price. For any of the students who are here, if you want to actually meet him personally, face to face, in person, he actually is going to be on campus, and we're going to have a special. This will be a tea with the dean as opposed to team with the dean. You got that, Amy? You know, tea. With the dean, you know, we'll have tea with Rob Sharp at 3 o'clock before our session, you know, and to meet with students. And then our final session will be on the 18th of April, and that's with Eamon Anderson, who is, you know, the managing director of Acumen Americas. It's a fund that builds startups that are dealing with systemic problems, and he actually is bringing a portfolio company who's actually going to, those of you who are interested in healthcare, he's bringing one of his portfolio companies they've invested in. It's from Seattle. And they've just contracted in Maryland. Nadine, you might be interested in this. They've contracted with the Medicaid providers in Maryland. They have a very special service for connecting, reducing costs for these Medicaid providers by being able to engage with people who are challenged, you know, in housing. And it's I'm not explaining it very well, but it's a kind of a unique, I think it's a unique concept and a unique business model for that. And so we're going to run a special, I'm going to run a special seminar with this company from Seattle, because I think there's kind of a lot to learn about how you can actually, the same as Nadine is talking, how you can actually use real business thinking to have an impact on hugely vulnerable populations, and you know, and in fact, you know, helping to reduce costs on the Medicaid providers actually helps to provide better services, because there's more money that can be redeployed. So that's our next sessions, and that's how they fit together. And that'll be after that. We won't have any more team of the deans until probably some other semester. We'll see. Okay. So look out for these announcements. And again, Nadine, thank you very much. It was great. I learned a lot. Thanks. Okay.
Thank you. Thank you for having me. I enjoyed the time.
Okay, thank you. Bye.
Bye.